Hi, we're Group 15 and this is our presentation for Posturaflexa. Poor posture is an ever-growing problem in our society. Increased computer use and hunching over desks can lead to poor posture. Office workers often report these problematic symptoms, and poor posture also affects students. Poor posture exacerbates musculoskeletal symptoms such as muscle strain as well as chronic back pain. While ergonomic furniture may help improve poor posture, due to the pandemic, many people are forced to work or study at home where ergonomic furniture may not be feasible. That's why we propose the compact and mobile Posturaflexa device, which you can bring with you wherever you go and improve your body posture. Simply place the Y-shaped Posturaflexa device on your back. The sensors help to track body posture and will send a notification to the app on your phone, laptop, or remote to remind you to adjust your body posture. The Posturaflexa will act as your annoying friend, colleague, or mother that constantly tells you to sit up straight. Posturaflexa software will help you to visualize your progress and posture improvement with weekly summaries as well. You can pre-order your Posturaflexa for $85.99 per shipment in December of 2022. Now we'll briefly go over these topics for the Posturaflexa device. Modern posture correctors are based on the principle of tissue adaptation, such that holding your body a certain way for long enough will cause it to conform to that position. For example, as posture correctors help to maintain correct posture, chest tissues may expand as back tissues contract. Posturaflexa gives the user postural awareness, or the subjective conscious awareness of body posture when they're slouching. Simply being aware of the fact that you're slouching efficiently prevents it. Studies have shown that posture is indeed associated with spinal pain, especially around the lower back region. Perhaps the Posturaflexa can prevent that. Studies of such biofeedback training efficacy have suggested that these modern methods may be superior to traditional physiotherapy in balance and gait for Parkinson's disease patients, as well as for effectively measuring disease progression and early identification of multiple sclerosis. For the product regulation section, we'll cover the modifications for the device to become a medical product, examine why it's a risk class 2 product, and argue why the de novo pathway is best for its approval by the FDA. The FDA considers a product a medical device if it's trying to prevent or treat a disease, which is what Posturaflexa helps to do. Posturaflexa's target audience would be people with musculoskeletal disorders who would benefit from posture reminder software. Also, making a strong claim for the benefits of Posturaflexa, including it not only alleviating symptoms, but also preventing disorders associated with chronic back pain, can help the wearable device be recognized as a medical product by the FDA. Posturaflexa would be classified by the FDA as a Class 2 medical device that involves moderate risk if not used properly or if it malfunctions, which can worsen conditions by enforcing bad posture. Posturaflexa can also provide medical imaging with its sensors, which can relay data about the spine and back muscles affecting back posture, which will also increase the risk level to Class 2. Finally, Posturaflexa cannot use the upright go-to device, which has been based on the predicate since the FDA has not approved the device and is no longer substantially equivalent to it. So we cannot use the 510(k) pathway for approval. The de novo pathway can be used instead, and the costly and time-consuming pre-market approval can thus be avoided. In terms of the intended customer, Posturaflexa is a device that's suitable for a wide range of individuals, some including students, older adults, and/or anyone dedicating long hours to their work. While technology is developing daily, the likelihood of gaining access to devices is also rapidly increasing, resulting in a decrease in age of access to the devices as well. Elongated periods of device use have a direct effect on posture due to the way the human body arches when engaging in screen time. Students often dismiss concern for posture through habits formed by studying for positions, for example. For the same reason, employees working with devices or simply working long hours are at risk of damaging their posture as well. Studies show that back pain is associated with longer working hours, which correlates with bad spinal positions, where the longer the spinal arch is held for, the higher chances of experiencing back pain. Posturaflexa can also be taken advantage of by the older population. Age is a significant factor leading to the harmful posture, as with age, the body weakens and has less support for an upright spinal position. Through experimental analysis, it is proven that older individuals possess more curved spine shapes than younger populations. This device targets the improvement of poor posture habits through alerting users. Thus, it is suitable for all types of individuals who can benefit from the encouragement of a consistent pattern of posture fixation. Having good posture means to maintain musculoskeletal balance and protect supporting body structures against injury and deformity. The spine has three natural curves: at your neck, the mid-upper back, and the lower back. The cervical and lumbar lordosis should convex forward, while the dorsal kyphosis should concave forward. Proper posture is maintaining these curves and not increasing them. This optimal alignment keeps one's center of gravity directly above their base of support and allows for efficient movement with the least amount of fatigue. Detriments to poor posture include shoulder, neck, and back pain, an increased risk of falling, an increased pressure on the spine that makes it prone to injury, and difficulty breathing and digesting food. A correctly aligned spine puts less stress on one's bones, leading to less pain and reduced chances of osteoarthritis. Studies involving a posture intervention of on-screen reminders indicate reduced musculoskeletal problems. Additional studies examine the role of posture on one's emotional state. Results indicate a correlation between good posture and better mood and energy. Good posture improves self-esteem, increasing self-confidence, and reducing depressive thoughts. Posturaflexa is a Y-shaped device that, when positioned in between the scapulae and connected to either a separate remote or the Posturaflexa app, utilizes the powerful inertial monitoring system, the IMS, which works in real time by keeping track of the three sensors in each Posturaflexa axis and makes sure measurement of each sensor does not deviate from what is originally calibrated as the user's correct posture. When it notices a deviation in the measurements, the IMS sends vibrations to the wearable in training mode. In tracking mode, it waits a few minutes before notifying the user. Depending on the time set by the user during the calibration, if the user does not revert to their neutral posture, the sensors will send the signal via Bluetooth to one of the two options. When either the app or remote receives the signal, an audible warning will be produced for the user to acknowledge and adjust their posture. Posturaflexa is also purposely designed with a lightweight thermoplastic polyurethane material and a long-wear pressure-sensitive adhesive that, although directly in contact with the skin, will maintain its flexibility and guarantee a long-time comfort to encourage users to incorporate the wearable in their daily life. Compared to the Upright Go 2, Posturaflexa provides more accurate biofeedback as it has 3 sensors as opposed to 2. There have been reviews of the Upright Go 2 tracking of movement as slouching when the user was actually just leaning forward, but with the addition of a third sensor, Posturaflexa reduces that risk significantly. The Posturaflexa is also suitable for older adults as well as younger adults, as it does not require a smartphone to use like the Upright device does, and attaches to the skin more efficiently with its wider, flatter, and more flexible material. Although physical posture correctors have the great advantage of diversity such that there are many different types that target different areas available on the market, it's not able to track the user's posture and analyze the data to implement a personal training plan like the Posturaflexa can. As such, the Posturaflexa is also much easier to wear or take off alone, and is more comfortable as it does not restrict movement like braces do, and discreet as it is not bulky and can be worn under clothes. The clinical study is designed to demonstrate the impact of an intervention and highlight the combined effects by regulating bias and limiting variation. Posturaflexa's clinical study aims to identify problem areas related to students' posture and help improve muscle retention through Posturaflexa's biofeedback mechanisms. Data collected from this trial will also be used to develop a more robust, statistically powered Phase 3 trial for FDA approval. The research question being examined is does the Posturaflexa device help reduce back pain associated with poor posture in post-secondary students? Posturaflexa's study is a Phase 2 clinical study that is single-blinded, randomized with stratification randomization of full and part-time students, with a primary endpoint of pain reduction caused by poor posture. Participants will be asked to wear the device for 6 months. The treatment group will have access to the real-time biofeedback regarding their posture and notification alerts signifying prolonged poor posture. The control group will have their posture monitored with the device but will not have access to the biofeedback mechanism. Instead, control participants will be provided with written instructions on properly improving their posture on their own. Researchers will assess Posturaflexa data, posture changes, pain levels, activity limitations, and average daily seated time. These variables will be evaluated in self-reported questionnaires provided at each study visit. A patent provides the patentee and their legal representatives the exclusive right, privilege, the liberty of making, constructing, and using the invention and selling it to others to be used. To determine if our device is patentable, we must assess the following, since an idea is only patentable if it passes all of the eligibility tests. The first test is the utility test, and the Posturaflexa passes this test. The next test is for novelty, and when we compare the invention to a single piece of prior art, which is the upright go-to, the invention could have been predicted by the person skilled in the art, so the novelty test is failed. The criteria that follows is a non-obviousness test, and the Posturaflexa also fails the test. The final criteria for patentability is the enablement test, which the Posturaflexa passes. In conclusion, the Posturaflexa device is deemed as non-patentable. This is a result of the product's inability to pass all of the necessary patentability criteria. That concludes our ideas for the Posturaflexa. Thank you for listening, and remember to stay aware.